And thank you all for being here and first day of April. So seems to me an appropriate April Fool's Day event to makes it perfect to discuss something as foolish as Medicaid expansion, and to remind everyone that Texas will not be held hostage by the Obama administration's attempt to force us into this fool's errand of adding more than 1 million Texans to a broken system. That's not just me who said that, by the way. In 2009, President Obama himself called Medicaid a broken system. Medicaid expansion is, simply put, a misguided and ultimately doomed attempt to mask the shortcomings of Obamacare. Texas was among the first states to say no. Today I stand with Senator Cornyn, Senator Cruz, Congressman Barton, and Congressman Burgess to repeat our stance: Texas will not be participating in Medicaid expansion. Our decision is based on what is in the best interest of Texans, all Texans, and is one definitive way that we can seek to minimize the damage done by the institution of Obamacare. It would benefit no one in our state to see their taxes skyrocket, our economy crushed, and our budget crumble under the weight of oppressive Medicaid costs. Already, Medicaid is responsible for 25% of our state's budget, and some estimates that if we accepted expansion, that number would jump to nearly a third. From 1990 to 2010, national Medicaid expenditures increased by 445%, while over that same time period, Medicaid caseload increased just 135%. And now we're expected to add millions to that system. Proponents of expansion insist it's a good deal because the federal government will pick up most of the tab, insisting that this is free money. Texans, however, know there is no such thing as free money. We know there's only money that's collected from taxpayers and money borrowed from other countries like China against the good credit of our children and our grandchildren. We're supposed to take the Obama administration's word about this funding on face value. But let's remember that this is the same administration that recently oversaw the release of thousands of criminal aliens because they couldn't find the money to keep them incarcerated. So they decided to deport them. It was a federally sponsored jailbreak that betrayed the most fundamental promise any government makes its citizens, and that is the promise to keep them safe. Some argue that we can withdraw from the expansion if or when Washington breaks its promise on funding. But experience has shown us that once in place, these types of entitlements are extremely difficult to scale back. All this is a hefty price to pay for a system that is, even now, struggling to deal with the caseload. In Texas, only 3 out of every 10 doctors are accepting new Medicaid patients, and we fear that number may actually decrease if expansion went through. Texas doesn't need another mandate, but the flexibility to care for our own in a manner that makes sense both efficiently and financially. We need to be able to use tools like asset testing to ensure resources are available to those who truly need it. We need health savings accounts, cost-sharing initiatives such as copays and deductibles and premium payments on a sliding scale. We need to give people more control over their health care spending, encourage them to take advantage of private coverage and other existing coverage options. Only then will we be able to truly begin dealing with health care costs. Expanding Medicaid is not a solution. It's not even a Band-Aid for what ails us. In short, it's a prescription for failure, and Texas will not be part of it. Now I'd like to take someone up to the podium who has been a strong partner in forging a strong Texas since he took over as Lieutenant Governor, David Dewhurst. Governor.
Governor, thank you, and Senator Cornyn, Senator Cruz, thank you for being here. I think we're here today because we want to make sure that at the end of the day, we save Medicaid and its ability to take care of and help the elderly, frail, disabled, and children. As Governor Perry said 4 years ago, President Obama said that our current Medicaid system is broken. Well, I agree with him. It's one of the few things I do agree with him on. It is broken. Our Medicaid cost here in Texas over the period between 2000 and 2010 went up over 130%. That 13% per year is now crowding out spending on public education and higher education and prisons and public safety and building roads. The current Medicaid system is threatening to bankrupt not only the state of Texas, but every other state in the country. And here we have the Obama administration, which is now saying, well, maybe we can send over 10 years $100 billion into Texas. That's nonsense. They're not going to be able to do that. They can't fund their current bills right now. I mean, would you consider expanding a broken system? Of course not. Of course not. It's like a drug dealer. You give them your first hit free, and then they're hooked for years and years. Governor Perry and I have been on the receiving end from Washington on the front lines working to stop these unfunded mandates. And we appreciate our partners in Washington, Senator Cornyn and Senator Cruz, fighting for a Texas solution to our problem. We've said no to Obamacare, and we're saying no to expanding a system that's broken unless we can find a way to fix it. I'm not sure we can. The last 7 years, I've been working on free market permissive solutions to Medicaid and to health care. That's why I'm pleased that in 2011 we passed Senate Bill 7 with the help of Senator Nelson, which allows pay for performance in health care plans, incentives for doctors to follow best practices and keep patients out of hospitals. And this year, again, working with Senator Nelson, we were able to pass a new Senate Bill 7 that does some of the same things for Medicaid by empowering our managed care companies, requiring them to provide for healthier Texans, and if they don't, their financial penalties. Medicaid's a broken system, and expanding it will only make it worse. You know the old adage, one size doesn't fit all, doesn't fit here. I think we as state leaders need to stand together and say that Washington needs to give Texas the flexibility it needs to develop a Texas solution to the expanding healthcare crisis in America. Just like we're recommending the Texas solution to getting Americans back to work and jobs. Governor?
David, thank you very much. And I'm going to ask Senator Cornyn, Senator Cruz, and then Congressman Barton, and then Congressman Burgess to come up one after another and just give their remarks. And well, good.
Well, it's a great country where people can protest outside the doors of the governor's office, and they're making their point. But the fact is, we share a common goal. We want to save Texas Medicaid. We want to make sure that the most vulnerable in our state have access to quality health care services. But as the governor and the lieutenant governor have made clear, you cannot do it by putting millions of more people into the flawed Medicaid system as it currently exists. There are plenty of good ideas out there, given the flexibility that we believe should be given to the state to help manage the health care of this vulnerable population, so that they have a medical home, so that their care can be coordinated, particularly when it comes to chronic diseases like diabetes. And under the current system, that simply isn't happening. And so one of two things is going to happen. One is the federal government is going to go broke and keep shoving more and more of these costs down on the state. And once they expand the Medicaid population and the federal government retreats, then the state's going to be on the hook. And it's going to go from about a quarter to more than the total state budget, crowding out other important government programs for our state, like education, law enforcement, and the like. Well, there are better ways to deliver health care than the fee-for-service system now. As the governor and lieutenant governor indicated, it's almost impossible for the population served by Medicaid to find a doctor who will actually see them based on what Medicaid reimburses, which is roughly 55 to 60% of what private insurance pays. And many doctors have simply quit seeing new Medicaid patients. But the final point I'd like to make before I turn it over to Senator Cruz, my partner in the Senate, is that the federal government is necessarily going to have to learn to live within its means. Right now, about 25 cents on every dollar the federal government spends is borrowed money. We know we can't keep living like this, and there's going to be consequences associated with it. So why in the world would we keep expanding this flawed system and jamming more and more people into a program where they can't find a doctor to see them? Why wouldn't we take the opportunity to join with these folks outside the governor's office right now and try to come up with a better way that serves their interests and the taxpayers' interests better?
I want to commend Governor Perry, Lieutenant Governor Dewhurst, and the leaders of the Texas House and the Texas Senate for standing strong against expanding Obamacare by expanding the Medicaid population in the state of Texas. They are taking a principled stance, and I think it's a stance that is in the best interest of Texans. Now, our friends outside are sharing rather loudly their view that what do they want? Health care, and when do they want it? Now. Sadly, Obamacare is a program singularly ill-designed to produce that. As Obamacare has been implemented, more and more Americans are seeing the negative consequences of Obamacare. They are seeing jobs drying up. If you're a young person right now coming out of school, with Obamacare beginning to be implemented, the odds are higher that you're going to have a hard time finding a job. If you do find a job, more and more employers are dropping health insurance coverage. So the odds are higher that you're not going to get health insurance from your employer because of Obamacare. And if you are lucky enough to find a job and find a job that has health insurance coverage, we're seeing premiums go up dramatically. When Obamacare was introduced and passed 3 years ago, President Obama promised the country that by the end of his first term, the average family would see his health insurance premiums go down $2,500. The reality has not matched those promises. In fact, what we've seen is the average family has seen their premiums go up by $3,000. That's a $5,500 swing out of the pockets of families that are struggling to make ends meet. If you're a single mom working hard to provide for your kids, more and more families are seeing employers forcibly reduce the hours employees are allowed to work. On the floor of the Senate just a couple of weeks ago, I read from a newspaper article quoting a single mom in Oklahoma who was working at a fast food restaurant where every employee had been forcibly reduced in their hours down to 29 hours. And this single mom said, look, I'm trying to provide for 2 kids at home. I can't do that on 29 hours a week, and it's because of Obamacare that our employers feared they would go out of business if they didn't forcibly reduce the hours people are working. Now, when it comes to Medicaid, Medicaid, unfortunately, is a system that is broken, as President Obama himself has acknowledged. If you look at the data, those who are covered by Medicaid receive substantially worse health care outcomes than do those in private insurance or even those with no insurance at all. The likelihood that those who are covered by Medicaid will spend longer times in the hospital and the likelihood that they will die of treatable diseases is higher than those with private insurance and than those with no insurance whatsoever. And yet what Obamacare is trying to do is move a great many people into Medicaid who are not currently covered. Medicaid right now, roughly 30% of doctors in Texas take Medicaid. That means 7 out of 10 doctors will not take Medicaid. And if you look at other states that have expanded Medicaid populations, what happens over and over again is the percentage of the state covered by private insurance drops and Medicaid picks up the slack. So you will be moving hundreds of thousands of Texans off of private insurance, off of insurance that is allowing them to choose the doctor of their choice, and onto a system that will deny them that health care coverage. Our friends who are saying they want health care do not realize that expanding Medicaid will worsen the health care options for the most vulnerable among us in Texas. Now, many advocates of the expansion say that the federal government is providing free money. Well, it's not free money, it's our money. It's the money that the taxpayers in Texas and all over the country have contributed to. And our federal government right now has a national debt that's larger than the size of our entire economy, $16.5 trillion. But beyond that, the federal government is much like an unscrupulous individual trying to convince a junior high kid to start smoking. They start by giving a few cigarettes and saying, just try it. And there's a bait and switch that's coming. For those states that are buying into this, that are expanding their Medicaid populations, they will come to rue the day because Medicaid will take a larger and larger portion of their state budgets. So if you care about other state priorities, if you think the state needs to devote vital resources to public education, to teacher salaries, to higher education, if you think the state needs to devote additional resources to infrastructure, to roads and water, if you think the state needs to devote sufficient resources to law enforcement and prison, keeping violent criminals off the street, if Medicaid is expanded, that is going to consume a larger and larger share of the state budget that will crowd out education and infrastructure and law enforcement. Medicaid needs fundamental reform. It needs to give the states the flexibility to meet the needs of the most vulnerable among us. And unfortunately, right now, Obamacare goes in the opposite direction. So I commend Governor Perry, I commend Lieutenant Governor Dewhurst, I commend the leaders of the Texas legislature for standing strong. Texas, once again, is leading the way. And John Cornyn and I are proud to stand with our leaders and our friends here in Texas. Thank you.
Well, I just assumed, since I don't come to Austin much, that this was former Yell leader Governor Perry's support group out there, and he's going to go out and lead them in a few yells in a minute. Don't mess with Texas. I'm Congressman Joe Barton. I'm Chairman Emeritus of the Energy and Commerce Committee, which is one of the principal committees of jurisdiction over health care. All that glitters is not gold, and the promise of Obamacare in terms of Medicaid expansion is fool's gold. It glitters, but it will not promise what it delivers. As Senator Cornyn has already pointed out, we're running huge budget deficits in Washington. The cost of the Medicaid expansion is tremendous, and the federal government flat doesn't have the money unless we raise taxes on Texans to pay for it. So it's a promise without the commitment to actually back it up. The Texas delegation in Washington, in the House, in the Senate, stands prepared to work with our leadership here in Austin. When the time comes to really fix health care, we will work with our state leaders to make that happen. And I think in Governor Perry and Lieutenant Governor Dewhurst and Speaker Strauss, we have the equivalent of Heisman Trophy winners Johnny Manziel, Robert Griffith III, and Earl Campbell. We have a triple team that will work together to really fix health care when the time comes that we want to do it.
Thank you, Joe.
Mike Burgess. I represent the 26th District, Tarrant and Denton counties. I'm also a physician in my background. I serve on the Energy and Commerce Committee, Vice Chair of the Subcommittee of Health. I also serve on the Rules Committee. I want to commend the governor not only for calling this roundtable today to discuss the future of healthcare in Texas, but Governor, thank you for your leadership in making Texas a leader in economic growth. Were it not for your contribution to the nation's gross domestic product, I think we'd be back in a recession. It's your jobs and your economic growth that are helping lift this country up out of the lingering recession. On the issue of the Medicaid expansion, H.L. Mencken said it best. If you say it's not about the money, it is about the money. The simple truth is the money is not there. The money will not be there when it is needed. Look at what happened in President Obama's pre-existing condition program that he created under the Affordable Care Act. It ran out of money at the end of January. People who are trying to sign up for that program now find themselves shut out. The same thing could happen with expansion of the state Medicaid program. I think the governor, lieutenant governor are wise. If you don't think that the federal government is an unreliable fiscal partner, just ask any doctor in the state. They'll tell you. Thank you.
Listen, I want to say thanks to all of the participants here, both the private sector participants and Senator, House members, Doctor. Thank you all for coming in and assisting as well, and to our senators and House members. We got great partners to get to work with. So with that, we'll be happy to.